Hello, this is Child Crest. It is all about the child. You're welcome to this week's edition of the program. We're continuing with our health education, a series on community health, one of the deadly diseases, a concern for parents that happens in the community is what we are going to focus on today. Timileyin is here to take us through what chicken pox is. We'll be back and then you meet my guests.
Chicken pox is also known as Vensula. It's a highly contagious infection caused by Vensula zoster virus. Rash is the most common symptom of this disease condition. The outbreak can be very devastating in a community, particularly with children with low immunity. Our guest is standing by in the studio to enlighten us on the topic for the week, chicken pox.
You're welcome back. The program is Child Crest, and I have with us a clinical virologist, Dr. Bamidele. Okay, you're welcome to Child Crest.
Thank you very much, ma.
Thanks for the other time, and it's glad that you could make it again this time.
That's ma.
So, what about chicken pox? I hear chicken. Is this chicken? You eat chicken? I mean, what similarities does it have with chicken?
Oh, unfortunately, no similarities. But funny enough, if we remove the feathers of the chicken, there's this tiny spots you can have the chicken. So perhaps that's
that's where it derives.
That's the closest similarity one can talk about. But chicken pox is another viral infection that affects children, and basically the children present with rashes also. But this time around, the rashes are very, very itchy. And then the rashes can progress to become blisters. And these blisters can leave scars behind. If it's on the face and the blisters get infected, then it can really cause cosmetic embarrassment.
Of course, on the skin, that is.
Yes, on the skin, on the face, and for women in particular.
We are so particular about how we look.
Yes.
You know. I hear the other name is varicella. Is that correct?
Yes, it's caused by it's called varicella zoster. That's what chicken pox is called. In adulthood, if chicken pox should come back, when people get immunocompromised, we'll call it herpes zoster. So in childhood, it's varicella zoster.
Okay. So for the one in the children, is there any vaccine to prevent it?
Yes, there's a vaccine. There's a vaccine also for it. I think what is not adopted, it's not one of the vaccines that's it's under the government schedule. So parents and adult parents can always buy by themselves and take to the clinic so that their children can get it.
Well, you're a practitioner in the medical field. Why is it because it's not common, or it's not something that government are concerned about? That's why it's not among the vitamin A, measles, tetanus, and all that?
It is common, but it's self-limiting, and it doesn't contribute so much to mortality. Okay. So I guess that's why so much concern.
It's not as deadly as measles?
Yes, not as deadly as measles.
So if it's not that common, what are the isolated symptoms of chicken pox?
Initially, the child there's something called malaise. The child just doesn't feel well. At that point, parents can't say what exactly is wrong with the child. The child is just not feeling well, to be cranky, crying, not eating. So one would know that this child is not feeling well. And then the child begins to run a fever, and then rashes begin to break out. So once it follows that sequence, most of the time everybody will say, oh, this is
So does it have an incubation period too?
Yes, I think that should be 9 to 21 days. It has an incubation period also. So if a child should come home and say somebody has chicken pox in my class, and then about 10 or 11 days later, the child to begin to present with the symptoms I've mentioned, then maybe chicken pox on the way.
Because I was going to tell that you actually preempted me, because if we have a place where chicken pox, there's an outbreak, and then the child's coming down with fever, so that should be taken, I mean, for granted that probably this child is also having same symptoms of chicken pox.
Well, with the fever and the rashes, and the child has not taken any drug, then one should know that the child it's time to go to the hospital anyway.
Okay. All right. So what are the kind of laboratory tests you do to isolate the disease?
Well, basically, like I said in your other program, that most of the time viral diseases, because of the cost of diagnosis and the expertise, the diagnosis is always challenging. But there are a lot of, despite that, there are a lot of laboratory assays that can be done. There's something we call ELISA, just in which you screen antibodies to the virus in the system of the child. And then there's something we call, we have molecular techniques, and polymerase chain reaction is one of the popular ones that we use. But since, like I said, chickenpox is self-limiting, and most of the time, by the time parents go to the hospital, the child may be on the recovery path, and then when they are asked to go and do a lab test, that is about 6,000 to 7,000 naira, and they are still looking for the money, the child may have recovered. So most of the time, we probably end up not even screening for it.
But as much as you say this, I hear that there are some far-reaching deadly complications that can arise from chickenpox.
Well, there is no infection that cannot have complication.
Okay.
Particularly if the person is immunocompromised.
Okay.
With lesser immunity, the greater complication one can have. And then other things that bring about complications are sharp practices. You know, we've seen children ill before, people squeezing onion juice into their eyes, or a child is not feeding appropriately, and like it was done several years ago, it's still being done. You gag up the child, you bend it, tilt the head, and you force feed the child, which also leads to another complication. So different practices also bring about, so there's no disease that cannot have any implication depending on how it is handled or what is done about it.
All right. We talked about even the complications on the skin that may require a visit to the dermatologist. We'll be talking about that. I think it is time now to go for a short break. And when we come back, our chat continue with Dr. Bamidele OKE, a clinical virologist. We'll be back shortly. Hello, this is Crest.
In the kitchen, when women are cooking, food hygiene goes a long way.
Potty training involves getting a child to be continent of stool and urine.
The parents feel stigmatized and treat the child differently from how you treat other children.
She is a protector, a giver, and a shield.
There's so many things that are being abused.
Herd immunity applies only to contagious diseases.
By making sure we wage war against rodents.
You look at the toys that you're going to buy for the child, especially children under the age of 2, you need to look at toys that they cannot swallow.
I knew that the media was the biggest platform to reach the largest number of people at any point in time. Now, setting the goal of starting a company. I started my company 13 years ago, myself and my partners. And it was a media company. At that time, it was ridiculous. How can these young people want to set up a media company? What do you know? The media at that time was controlled by a small percentage of the society's elite. The reality was, you had to have a lot of money, or you had to know a lot of people. But I was stupid enough to believe in my dreams, and I went for it. Sometimes, like the author of Philly Speaks says, stupidity can save your life, because it did mine. Now, starting early. I was only 18 when myself and my partner Chude Judon embarked on this journey to build a company, to build not just a company, but a movement. We were trying to shape narratives and inspire young Africans to live their best lives and be their best self. But before 18, I started leaving home at 14. Who is 14 here? Who is 18 here? Nobody. 16. Great. I started leaving home at 14, pounding the streets and finding my dream of being an actor. At that time, I would go from audition to audition, location to location. I would receive many no's, but I would get back home, and the next day I'll be back on the street. I trekked miles because I didn't have money to enter transportation. I would go home, I would wash, I would cook, I would clean for my older siblings so that they could give me money to take me to the next audition, knowing fully well that I had no money to come back home. But I would go because I was hungry to make my dreams a reality. I worked for free at many places, including NTA, where I finally got a break. And they gave me a show to do on NTA called All Night Long. It was a midnight show, and I was working for free. I was grateful to be given an opportunity to work for free at that age. I was a presenter and a producer. After 1 year of working with NTA, they started paying us a stipend of 2,000 naira, and I learned a quick lesson from that. 2,000 naira. I'm on TV every night, people know me, I'm not a big boy. I will not enter bus again and start taking taxi. Of course, after 2 weeks I was broke. I learned my first lesson on not to eat as you earn. It will help you if you always remember that. The best time for you to start is now. Don't let anybody say to you, you're too young. I was with the 40-year-old president of France yesterday, and he told me, many people told him he was too ambitious. They told him to wait his time. They told him to wait his time. They told him, you're young, you're 39, you still have about 30 years more to be president. What if you had listened to them? Would he be a president at 40 years today? No. It is not their fault when they tell you to wait. It is not their fault when they tell you you can't do it. It is the limitation of their perspective, the limitation of their own capacity which they project on you. They don't mean harm. They can only see from where they are standing. But they haven't seen your dream. They haven't seen your vision. They haven't dreamt what you have dreamt, the world you have created. And so, you have to move, driven by those dreams. And that is why it's important to surround yourself with friends and mentors who truly are the right ones. Talking about mentors, counsel is very important. Counsel brought me here by seeking out.
You're welcome back. Child Crest is the program. Our focus today is on chicken pox. We have been told that apart from removing the feathers from the chicken and the skin, imitating the skin of the patient with chicken pox, there's really no similarities or no relevance to the chicken that we eat. Dr. OKE is still here. Now, still talking about the complications from chicken pox. I hear that the blisters can be so damaging that you start running to see a dermatologist. Is that true?
Yes, because like I said, it comes with itching, and when a child is itching, the child can begin to make the small scar or the small spots, the child can make it get bigger, and that becomes an open wound. I've had the experience of a child having tetanus as a complication or sequel to chicken pox, because the child had sores all over the lower limbs, and that becomes an open wound that bacterial infection can, implant upon. So with scratching and making it a big wound, it can become a scar if it heals appropriately, if it doesn't, And if a child is malnourished, I keep on saying malnourishment, malnourishment, because that's the essence by which we fight infection. So we've seen very, very big wounds arising from chicken pox, and that can lead to some other things.
All right. So you keep talking about, you keep harping on this immunocompromised. Who are those that are predisposed? Who are those that can be immunocompromised, that may be predisposed to chicken pox diseases, even amongst the adults, the parents?
Oh, well, children are the number one population because of the kind of feed they receive. So children can be malnourished, and once a child is malnourished, the child is bound to be immunocompromised. And then people that have chronic infections like tuberculosis and HIV. In fact, HIV is the most popular one for someone getting immunocompromised, and it also affects adults. And like I mentioned a while ago, adults too can have chicken pox, and this time we call it herpes zoster, and it's a very, very debilitating disease. Also comes with severe pain wherever it appears on the body. So both we always categorize people in the early age and the older age into the group of or people that can be immunocompromised.
Okay.
But with HIV and some other kind of treatments, the average age also can fall into this group.
So what are the treatment options for chicken pox?
Well, chicken pox will manage the fever as usual, because fever leads to further complications. And then the child has a cough, we want to give in to subdue the cough. We want to manage the blisters as appropriately. One of my old professors will say, give the child paracetamol and treat the mother with calamine lotion.
Okay.
Because no matter what you do, if you have not given that calamine lotion for the child or oatmeal for the mother to apply all over the child, then the doctor has not done anything. But one significant thing is that parents or health givers should avoid giving certain drugs that we classify under non-steroidal anti-inflammatory drugs, NSAID, something like ibuprofen, which is quite common for children who have pediatric dose. So it complicates chicken pox.
Really?
So paracetamol, it is good enough to treat.
Thank you very much. Any final word on this?
Well, for those that can afford it, the vaccine is available. Yeah. So from reputable pharmacies, one can get the vaccine and take to health center. We should, as much as possible, avoid overcrowding, and then we should listen to our children. Sometimes our children will say, somebody has rashes in my class, and they're like, oh, just go to school. Maybe it's time we visit the school to find out what is going on. So those are certain things we can do.
That's a good one, and a very good place to round off. Thank you so much for coming on the program. Yes, that's how it's been. Optimal, heightened health education on Child Crest. It is all about the child. Continuing with our series on community health, and of course, zeroing on viral diseases. Our focus has been on chicken pox. If you liked what you saw today, only other way to join us is to stay tuned to next week's edition of the program, Child Crest. And to come your way, bye for now, and God bless you.